East Africa is home to millions of refugees and internally displaced people. Many were forced to flee their homes from violent conflict or food insecurity and are living in sprawling refugee camps across the region. This is already a vulnerable group of people, and now, as the coronavirus spreads across the continent, what new challenges are they facing? We spoke with Dana Hughes, the spokesperson for UNHCR, the UN Refugee Agency, to learn more. Take a look. Dana Hughes, thank you so much for joining us. You are the regional spokesperson for UNHCR in the Great Lakes region, the Horn of Africa, and East Africa. Self-isolation, regular hand washing, these preventative measures that are globally recommended to protect yourself from coronavirus. What are the challenges for people living in refugee camps or even for refugees in urban areas?
This is the region hosting the largest number of refugees on the continent. It is a region where there are large numbers of refugees in settlements and in camps that often lack some access to water and sanitation, that may have trouble and challenges having access to healthcare, and these are areas that are highly densely populated. So yes, the refugee population is quite vulnerable to this. However, I would also say that as UNHCR, well, the first thing I would say is that it's important to realize that as of now, as to date, there hasn't been any confirmed cases of COVID-19 for any refugees in this region. That said, we are well aware that it is a race against time to prepare. From early on, I would say even in February, many country operations, I know for a fact in Kenya and Dadaab and Kakuma, they started working with ministers of health, with the Ministry of Health and local governments to identify isolation wards, equip them with beds, and make sure that they would have the same type of healthcare access that citizens of the country have. There is across the board increased hand washing stations. There's also increased distribution of soap. Many operations have put in place social distancing guidelines for food distribution and other non-food item distributions, where you can see we actually have video of in Kakuma chalk drawn that's 1.5 meters, so that refugees, as they're queuing to get their food distribution for the month, they're standing 1.5 meters away. We're increasing our protection capacity, and that means working with epidemiologists and also a very vast network of well-trained community refugee volunteers to help identify potential cases. So, you know, I would say that we cannot ever be certain, that the whole world is living in an unprecedented time, but we are doing everything we can to be as prepared as possible.
Could you talk a little bit more about the role of people on a grassroots level? What are refugees themselves doing to kind of protect themselves and also educate and protect their community at large?
Well, it's absolutely crucial that we have refugees and people at the grassroots level, not just because they're there and they have access, and also, to be honest, as part of our prevention and mitigation measures, we do not necessarily want lots and lots of international staff roaming around the camps right now. So, you know, we are there and we are finding other ways to deliver services, but we're really relying on those who are grassroots right now. So there's that aspect, and that's not just refugees, it's local partners, it's local national partners. But the other aspect is trust. And you know, in any community, people are more likely to trust the people that they know, to trust the elders in their community, to trust their own mothers and sisters and brothers and fathers. And so when you are dealing with a pandemic, and you know, this is one that in this region we've before had to deal with Ebola. And there are several lessons that we learned, particularly in places like Uganda and in Congo, where we learned lessons from, you know, from that epidemic, uh, as to what's really important in preparation. And that community element, that grassroots element, that having refugees involved in not just getting out the message, but in how we communicate and what the message is. It is crucial and it is key to preventing, and then, you know, we hope not, but prevention and then care and treatment should there be an outbreak.
Have you been able to get aid and humanitarian assistance to refugees in the region? Or has that kind of, you know, as the borders close and the world kind of shuts down, have you been affected in that?
We haven't necessarily seen a huge effect of that. And also, it's important to remember that a lot of these border closures do not necessarily include trucks, aid, food, not just for refugees, but for the general population. I think what we are looking to do is to make sure that on the ground, we are both protecting refugees and our staff. So it's more, how do we then make sure that refugees get the aid that they need without inadvertently exposing them? And that comes with, you know, very careful contingency planning. You know, we often say that everyone counts, right?
Mhm.
And that refugees should not be left behind. But what we've seen with COVID is that it is truly a global crisis. And, you know, leaving anyone behind, whether it's refugees, whether it's impoverished people, whether it's the global south, it's not, it puts millions of lives at risk. But it's not just about protecting refugees or IDPs or the communities that host them. Really, it's about protecting all of us.
Dana, thank you so much for your time. I really appreciate getting your insight. So it was great to talk to you.
Thank you.